Ready?
Go.
You use this during a cap change to pick up your site scrub because it's not sterile.
2x2 gauze.
Yes. Every time this happens, you're doing CHG wipes, linen change, education.
24
Yep.
hours.
Great. And your head blocking if there's no infusing going continuously. Also, if it's compounded medications, fluids, TPN with lipids, intermittent infusions, piggybacks, and lipids, we change our tubing every 24 hours. If you're accessing the line less than 3 times in 24 hours, you can get a head block order. You're going to document line this hours. That's it. This is how often we change the cap with the tubing, and then we document it. In
96 hours.
Yes, we're changing the cap and the tubing together. We're documenting in the team communication and LDA flow sheet. We're highlighting it as significant data. Every 96 hours, we also change the tubing for continuous IV fluids that are not compounded by pharmacy. And then we make sure we label our tubing with our date, time, and initials. This is that little circle thing on the dressing that we use to fight infections. The blue side goes up and the white
BioPatch.
Yes, the white side goes to the patient. Make sure that your tubing rests on the slit, that the slit comes together as much as possible, and you rest your tubing on that slit so that it's not, it helps to make the dressing change easier to change if it is lined up. There's no need to use it when you're using an IV clear, and you do not put no sting barrier below that. This is something that you put on your head to wear during cap changes and dressing changes.
The Bouffant.
Yes. This is something we do every 96 hours, or if we see that it's 1/3 soiled, or every 24 hours if you've had propofol, blood, or lipids.
Oh, cap change.
Yes, and we also do it on admission. Each cap change requires a separate kit, and you need separate gloves for each cap. It's a sterile procedure, so make sure you're doing that properly. You can use your sterile gloves to set up your sterile field. Amazing. The PICU has not had one of these for 5 years and celebrated with cake.
Collapsing.
Yes, and the pediatric floor has not had one since July 2020. That's fabulous, isn't it?
Ooh, ooh.
All right, you're gonna put this on all your unused tubing ports. They're green.
No.
Oh, shoot, I missed one. Hold on. We're out of alphabetical order. All right, we are going to do this every hour if somebody is less than 36 months old. If
Oh,
they're-
assessments.
Yes, a central line assessment. If they're greater than 36 months, we do it every 2 hours. If it's head blocked, we do it every 4 hours. And we also want to assess it to make if the patient's complaining of pain or if there's swelling, redness, or drainage. All right, these we put on all unused tubing ports. It's not a substitute for a site scrub, and it's green.
Curos.
Yes, and it's not a substitute for alcohol either. And when you take it off, you still need to scrub. They're not a substitute for the things that we use to clean it. After putting it on within 1 minute, it's disinfecting and protects up to 7 days if you do not remove it. Consistent use of these decreases collapses. We do this every 24 hours. It's part of our SPS bundle. We're going to document it. We're going to document when they refuse it. We're going to highlight it as significant data.
A bath.
Yes, daily CHG baths. Part of our SPS bundle that's to eliminate harm across all children's hospitals. They say that they've saved more than 11,000 children from serious harm because we do the things that are in our SPS bundle, and saved hospitals over $182 million. All right, we do this also every 24 hours. It's in the SPS bundle as well. You're going to document if patients refuse it.
Well, I know we give linen change with our baths, so I'm gonna guess linen change.
Good, you are correct. Part of the SPS bundle, the purpose is to eliminate harm across all children's hospitals. More than 135 hospitals are in this network and they're committed to their mission and goals, remember to document it and document it if the patient or family refuses it. We put this on our labels, we put it on our tubing label, we put it on our dressing.
Date, time, initials?
Yes, you got all of them. And don't forget to document in the chart that you have changed the tubing and changed the dressing and highlight it as significant information. All right, this is the thing that we do when we're changing the linens, when we're doing the CHG wipes, we're changing dressings, changing caps.
Documentation, 'cause we
Yes.
all know if we didn't document, we didn't do.
Thank you, I was gonna say that exact thing. You are so smart. All right, cap changes, tubing changes, we're doing education and documenting it. We're doing the dressing status and the line necessity. We always wanna document as well if the patient's complaining of pain or if there's swelling, redness, or leaking at the insertion site. All right, this is something we do every 7 days. If it's soiled or wet or loose,
Dressing change.
yes. We do dressing changes, we do not reinforce dressings. You don't have to change it 24 hours after the dressing was put on when it was inserted. If it's a PICC line dressing, within 24 hours you have to call the PICC nurse to do the dressing change. We do not do those. We use IV Clear or we use the IV Advanced dressings. We don't put any ointment under the dressings, and if you're changing a dressing, you need 2 nurses. If the parents want to do it or the caregiver wants to do it, a nurse has to be in there to be a witness to it and observe the process. Make sure when you do your dressing change, you label it with the date, time, and initials, and document it in the LDA flow sheet and make it significant data. And update your team communication as well. If you're doing a PICC line, you should measure from 0 to the insertion site and document if it's the number. If it matches the number that has been there before, everything is good. If it is not the same as the one previously, call the doctors and document it. This is required every 24 hours when you have a central line. Something we do with families.
Educate.
Yes, you put in community hospital acquired infection, and every 24 hours we need to document that we've educated the family on the signs and symptoms of infection, the treatment that we would do, how to reduce the risk of infection, and home care. We need to do this all the time. When you're going in a room, when you're coming out of a room, before you put on gloves.
Hand hygiene.
Yes, you're always doing the WHO hand washing method that you learned earlier today. You're washing your hands before and after sterile and non-sterile gloves, and before touching any lines. And after you've washed your hands, be aware of anything you touch, because you might be picking up germs and spreading it to the next thing you touch. All right. If there are no fluids going, we do this every day. When we're deaccessing, we do this.
Heparin lock.
Yes, if we're deaccessing a port, we use 100 units per ml to head block a port. If you're head blocking a central line or a PICC, we just use 10 units per 1 ml. If there are no fluids going, you head block it daily. If you have less than 3 accesses in a 24-hour period, you don't have to have fluids running. You can head block the patient. All right, we use these for long-term access. You use a Huber needle.
A port.
Port, yes. This is an implanted metal or hard plastic port with an injection reservoir that's self-sealing septum and attached delivery catheter. All right, this is something we change every 96 hours or when it's 1/3 visibly soiled. We change it at 24 hours with blood, lipids, propofol.
Oh, our caps.
Yes, and we also change them when patients are admitted with a central line. You do not have to do it on discharge, though you can if you'd like. You're going to clean it with the side scrub, twisting 8 times for about 10 seconds, and then let it dry for 5 seconds before you access. All right, we use these on the white central lines. They have CHG and silver embedded in them that optimizes protection over the surface area of the dressing.
IV Clear?
Yes! IV Clears exceed the modern antimicrobial standards on gram-positive, gram-negative, and yeast that is commonly associated with CLABSIs. The silicone adhesive technology minimizes pain during dressing changes and won't irritate the skin. Don't use skin prep under an IV Clear, and they don't need a biopatch. Use adhesive remover only on the white parts. We're learning so much here today.
We are. I am so excited to do my next dressing change and document it.
We wear these all the time.
Masks?
Yes. Masks are put on for everybody in the room when you're doing the dressing change. The only one who maybe wouldn't wear a mask is the patient if they don't tolerate it. This could be an IJ, a subclavian, a femoral line. They're for short-term use, less than 2 weeks.
Non-tunneled
Yes,
lines?
yes. We can also use them for CBP monitoring, TPN, or complex medication therapies. All right, this is used this is used maybe in an arm, and we use it for TPN and lipids, IV meds, or fluid if they're in the hospital.
PICC line.
Yes, if a patient needs the fluids and things for more than 6 days, we're gonna insert a PICC line. This is when you flush with 1 ml, stop and repeat.
Oh, push pause.
Push pause. It's really the way to flush a central line because it causes turbulent blood flow, which helps to keep the sides of the catheter clear and prevents buildup of fibrin in the tubing to help keep your central line patent. So when you need it, it's ready to use. Oh, when we do the CHG wipes, we're gonna do this to our charting. When we do the linen change.
Significant data.
Yes, makes everything significant data so it's easy to spot when you do your wipes, when you do your linen change, or if the family refuses the linen change, when you change the tubing or the cap and the dressing. Make those all significant data in your charting. These hang on a pole in the room. They cost 25 cents each. You use them for 8.
Site scrubs.
Yes, site scrubs are to reduce 99.999% of microbes associated with CLABSIs. 8 rotations, slowly, not fast, is approximately 15 seconds, and then you let it dry for 5 seconds before you access the line. If you're not gonna use the site scrub, use alcohol for 15 seconds and then let it dry for 15 seconds. Oh, and the things on the pole in the room, the little boxes, are not for using over and over again. It's a single patient use, so when the patient leaves, you need to remove that and dispose of it properly. All right, this is something we put on when we're doing dressing changes that protects the body from fluids and adhesives and friction.
Skin prep.
Yes. When you're doing your dressing change, you're gonna put your biopatch on and go out there. This does not go under the biopatch. Once you put it on, you're gonna let it dry for 1 minute. It's very fast drying and non-sticky. And it forms a breathable, transparent film that protects the skin. And it doesn't sting or irritate the skin when you apply it. All right, when we use these, we wash our hands before. We can use the wrapper as a sterile field.
Oh, sterile gloves?
Sterile glove.
Thanks for the hint. That was a tough one.
All right, so we're gonna use that as our sterile field. Use new gloves when you're changing the caps. If there's more than 1 cap, put on a new set of sterile gloves. And when you're doing a dressing change, your second nurse that's there should also have on a pair of sterile gloves, so that if needed, when you're taking the dressing off, they can stabilize the catheter. We also want to be aware of the non-sterile gloves, and if they fall out of the box, don't pick them up and put them back in the box. They're contaminated. There's germs on those. You have to just throw them away. And always be aware when you're wearing sterile gloves or regular gloves that when you're touching something, you're picking up germs that you're passing on. So sometimes when you're around, you need to wash your hands and change your gloves more than once so you're not passing germs on to the patient. All right. This is something that comes in your dressing change kit. You wouldn't put a site scrub on it or normal saline.
Oh, my sterile field.
Yes, you got it in the dressing change kit. You can also use the wrapper of your sterile gloves. Don't put your side scrub on it or your normal saline, like I said, and then drop your supplies into it before you hand wash and put your sterile gloves on to start your procedure. All right, this is on the, I think it's not on the flow sheet. It's part of the chart where you can find when the last dressing change was done or when it's due, the cap change, when they need to change a room.
Oh, the team communication?
Yes. You can sometimes find your doctor and the team that they're on, red or blue there, along with their phone number as well, and other important information. Oh, this would be a Broviac, a Hickman.
Tunneled catheter.
Tunneled catheters, yes, you are correct. This is for long-term access for greater than 4 weeks. It's tunneled subcutaneously from the insertion site. Also a Grosjean. All right, this is something that we use on a 2-lumen Broviac. Sometimes use it for dialysis.
Stat lock.
Yes, we use the dialysis stat lock just below the dressing. If it is under the dressing, you just change it when the dressing needs change. If you have a pick, you want to make sure the wings are up under the dressing and no stat lock is required. This is something we do to help give us extra protection even with the stat lock, because we have these busy kids that bounce around in the bed with their central lines, and it helps prevent keeping the line from being pulled on.
Stress loop.
Yes, for Broviacs or any catheter with enough length, you're going to create a stress loop under the dressing.
Those kids stress as hell.
They do, they do. All right, we used to use these, but we don't anymore. You do need a BioPatch under this.
Sorbaview.
Yes, we now use IV Advance. You're using the BioPatch under, you are going to use skin prep and let it dry for a minute. No stat lock is required with these dressings. They're breathable and protect against bacteria, virus, and contaminants. Oh, this is a great tool when you're doing sterile procedures in the room.
Stop sign.
Oh yeah. Exactly, that's gonna stop people from coming in the room and interrupting your sterile procedure.
Can I use that all the time just so nobody comes in my room?
Use your best nursing discretion. All right, we do this with the site scrub for a minimum of 10 seconds.
Twist 8 times.
Twist at least 8 times for a minimum of 10 seconds. And then you let it dry for 5 seconds before accessing the line. HG wipes, linen change, refusal of linen change, tubing change, cap change, dressing change.
Significant data. Yes. Woo-woo.
All right, now pause so you don't